Associate for Steps to Health NC State SNAP-Ed grant. And on the behalf of Steps to Health and Faithful Families Thriving Communities, welcome to the second part of our three-part series of impacts of COVID-19 and food security, physical activity, and health. Our previous webinar focused on COVID-19 and some results from a survey that was distributed through North Carolina as it relates to food security. And that recording can be found on the Faithful Families website for you to review at your convenience. But today we are going to focus on, again, COVID-19 and physical activity. We have some presenters that are going to talk about the importance of physical activity in light of COVID-19, ways communities can encourage physical activity. And then lastly, we'll be sharing some success stories from our Steps to Health team and Faithful Families as well. Before I introduce our first speaker, just a few housekeeping items. This webinar is being recorded, so again, it will be housed on the Faithful Families website, and I'll be sure to post that in the chat so you'll have access to that. And secondly, feel free to engage in the chat. You can comment or ask questions, but please note we won't get to your questions until after all the presentations have been completed. So let me post the link to the previous recording. Okay, and then that again will be used to access this recording for this webinar and the webinar that is scheduled for next Monday. So I'd first like to introduce our first speaker, Dr. Jason Bocarro, who is an alumni distinguished undergraduate professor and university faculty scholar in the Department of Parks, Recreation, and Tourism Management here at North Carolina State University. Dr. Bocarro's research focuses on the intersection of childhood and adolescent health and inactivity, and specifically examining the relationship between the built environment and public spaces and human health. Thank you, Dr. Bocarro, for being with us today, and I will pass it over to you.
Great, well, thank you. Can you guys all hear me? Thank you very much for having me today, and it's good to see some familiar faces. What I'm going to do is I'm going to share my screen with all of you, so hopefully you can see this. Sorry, I'm going to try and be as efficient as possible. Can you all see my screen? Great. So I want to start off by saying that this is something that I'm very, very, very passionate about. This is a topic that prior to COVID-19 that I saw the importance of physical activity from a very early age, and worked in England and Canada, where I worked for various youth sport organizations, for park and recreation departments across 3 different countries, and I really tried to engage communities to be more physically active through the programs that I was involved in. So obviously, COVID-19 has provided us with a whole host of challenges in there, but I do want to share, I mean, many of you know the benefits of this. You know, one of the big statistics that came out a couple of years ago was, you know, 90% of the nation's 3.3 trillion in annual healthcare are for chronic and mental health related issues. And this isn't just, you know, some of the physiological aspects of being inactive that we should be worried about. But if you think about COVID-19, mental health related issues have really increased dramatically. And a lot of my work has really looked at this intersection of mental health and physical activity. And I'm really very, very passionate about the impact that this this can have. So obviously, we also know about the importance of physical activity. 40% of the population has 2 or more chronic conditions, such as hypertension, diabetes, and mood disorders. But one of the other things that we know about COVID-19 is that if you have some of these underlying chronic health conditions, you're more at risk of recovering, taking longer to recover, or being hospitalized. So this is the importance of physical activity cannot be understated. We know that some of the big comorbid issues related to COVID-19 that has poor outcomes are stress, diabetes, mental health, hypertension, relationships with each other as we're stuck inside. And potentially can't get out as much as we'd like to, heart disease and cancer. And, I've got some other statistics in there, but, I read something, a recent research article. It says about 50% of the American population right now is at risk of diabetes or pre-diabetes, which is one of the COVID-19 risk factors that we should be really, really concerned about. So we know that physical activity can be a really significant buffer. And so it's something that, all of us working in this area should be really pushing to promote. I want to share a personal story in here today. This is me and my sister from a long time ago. And I was a collegiate athlete. That's what brought me to the US. But prior to that, I always took, being physically active pretty important. And my sister didn't. She's pre-diabetic. She has hypertension. She's actually a nurse in England, an ER nurse in England, and working at the Nightingale Hospital, which was the COVID hospital. And actually, back in February for me and March for her, we both got COVID. So I got it. It wasn't the most enjoyable 3 weeks of my life, but recovered, moved on and that kind of thing. She's in week 16 or 17 now, and we've got the same genetics. And she spent 13 weeks off work, and she's seeing a specialist. She's still having some pretty negative health outcomes. So, for the last 20 to 30 years, I've been encouraging her to take better care of herself, to be more physically active, to eat better and that kind of thing. And I think this was really, really interesting to me. So just a quick little personal story there in there. So, as we start thinking about, physical activity in this new world, what are some, and you can post some of your comments in there. What do you think about this? Some of these images here. This is pre-COVID. We'd look at some of these images and go, wow, that's amazing. Working out together within a community, using some great adult fitness equipment in there. Look at those kids in there, hugging each other at youth sports, and look at those seniors being physically active in that environment in there. And then you look at things like this. Any reactions you can post in the chat box within there. Any reactions? Yeah. So I think, some of the reactions you see that. So, 6 months, 9 months ago, those images would have really pleased us and got us really excited and those kind of things. But now we're faced with some additional challenges. And one of the other things that I've been doing right now is I've been doing a lot of work with the National Recreation and Parks Association, the National Association of State Parks across the country. How can we balance these issues of trying to get our community to be physically active while keeping them safe and adhering to all the CDC regulations and recommendations relating to physical distancing and appropriate use of some of these facilities. And this is something that I think, I want to leave you with today in terms of how we can keep these spaces open, but also keep them safe for our community to use. in there. So again, I'll ask you this question here. What do you think are some of the most significant barriers facing people from being physically active during COVID-19? And you can post some of your reactions in the chat box in there. What are some of the significant barriers? And Breyana, if you could read some of them out, that'd be great.
Yes. So fear, embarrassment. A lot of people mentioned facilities are closed. Fellowship, so missing the time to fellowship with others, or even having an accountability partner. Stress, reducing motivation, safety, and convenience.
Great. Yeah, and I think I know Lindsay Haynes Maslow last week talked a little bit about some of the survey results that came out, and she talked about many of these significant barriers and how physical activity was something that folks wanted to get out and be more physically active, but due to kind of work stresses and due to facilities such as gyms being closed, some of their options to be physically active were really lessened. And I think this is a role that I feel that you all can play to help your community be more physically active. So this is some work that I've been doing with the National Recreation and Parks Association. Most park and recreation agencies are working very, very hard to keep their trails, their parks, and their community gardens open. That's going to rely on the community really using these facilities in a responsible way, but they are very, very, very committed. And I'm working with them. I'm working with North Carolina Recreation and Parks Association right now, so that we can keep these spaces open, particularly as more of the indoor facilities, such as gyms, remain closed. So, you know, one of the questions, I did a webinar with a bunch of Recreation and Parks Association members across the country. And one of the questions that I posed to them was, what are they doing to prepare for this new reality in a post-COVID world? This isn't something that's going to go away in the next week, 2 weeks, month. So we can't just shut things down and wait for this to kind of go away and then reopen, because in that time, people are going to not be able to be to gain the benefits from physical activity. So we really have to think about this and how we advocating our value in times that will certainly be an environment of diminished resources. So I think many of the resources that you operate, you know, they're going to be critical as more and more organizations and facilities and amenities suffer from some of the financial ramifications of this COVID-19 reality. So I think this is going to be an environment with increased partnerships, increased resources, sharing of resources and facilities and amenities. So how do we structure that so that they're used in a really safe way and safe environment? So I wanted to share with you a couple of videos in terms of showing you what's going on. These are some videos from park and recreation departments across the country. Hopefully you can see this. This is in Onslow County, so some of you may be from that area. So can you see this video? Okay, so just a little video, and I've got another one that I'll share hopefully at the end of a fitness class going on in the same manner. So people and organizations are starting to look at how can we do what we did in indoor environments, how can we do what we used to do in the same way to get some of those same benefits in there as well. So I know some of you may have seen this before. I know it's really framed a lot of the work that many of the extension agents have done, this whole notion of the social ecological model. And if you haven't seen this before, the idea behind this is that there's different layers within this model. And, you know, as practitioners, as folks that work in this health sphere, the more layers and levels that we can positively impact, the better the outcome would be. So we've got, you know, looking at things, you know, at the interpersonal level, we can work with individuals. We can persuade them that these types of behaviors will help their health. So, you know, if you look at, you know, physical activity, we can persuade people individually that walking 60 minutes a day or 30 minutes a day is good for them. But that alone, what we've seen, isn't good enough. So at the interpersonal level, how can we maybe create that same environment with friends and family members, and so that we can influence the people around individuals that these health behaviors are good. And then spreading out, what can we do from an organizational perspective? What can we do within our community? And how can we influence public policy to make more, you know, walkable amenities and facilities more available? Or how can we change various, you know, policies, physical activity policies, food policies, to influence each of those different sectors? And that's very much guided the work that I've done and worked with folks like Lindsay Haynes-Maslow and Annie Hardison-Moody and many of you guys on that. So, so one of the things that I do want to also point out is that is the importance of outdoor physical activity. So, you know, I like to look at things in the glass is half full. During this pandemic, sometimes hard to do, and that's a picture of my daughter and I just going on an outdoor hike last week. You know, here's the thing that I wanted to impress upon many of you. So yes, it's hot out there. We may be dealing with a hurricane, you know, tomorrow and that kind of thing coming to North Carolina. But, you know, one of the things that our research has shown is that being physically active in outdoor environments has even more benefits than being physically active indoors. So this natural setting actually has some mental health benefits that working out indoors doesn't give you. So there's some really big mental health benefits of outdoor physical activity. So while some of our indoor environments are closed or we have restricted access to them, that we have the opportunity to potentially get people out in outdoor environments to gain some even greater additional benefits of physical activity, right? And, you know, there comes with a challenge for that. I've been working with the state parks in North Carolina that when the pandemic first broke and we had the lockdown, the state parks in North Carolina were completely overrun to the point that because of that, we had all these new users, which in one respect was great, but it created such an overwhelming response that many state parks ended up shutting down. And we don't want that to happen. So I'm working with them right now to try and prevent that from happening. Structured programming, for those of you that, you know, are in faith communities, think about this. We know that if we have structured programming like the example I just showed, that brings people to areas and they're more likely to work out. So thinking about creating that environment. And here's the other thing that I'm really passionate about. Often when it comes to health and the benefits of physical activity for preventive healthcare measures, we look to medical providers, but research shows that they really lack confidence in giving patients advice related to physical activity. So often we could be those experts that fill that niche along with medical providers. And that was a study I could talk a lot about, where I worked with federally qualified health centers in 2 counties in North Carolina in there. And I'm happy to kind of share with you any of that information if you're interested in that. So last thing I want to say is a big national study was done And US adults feel that parks are essential. They really see and are seeing more and more exercising in local parks, trails, and open spaces. And some of you may have access to some of these open spaces as essential, particularly during the pandemic. So this is an opportunity to provide, you know, some knowledge and some opportunities for individuals. And the last thing, you know, I want to end with today is how do we challenge, how do we keep our citizens engaged and connected while communicating kind of safe adherence to physical activity, right? So this, you know, if we can safely distance at the grocery store, surely we can do the same at parks, and you know, really thinking through some of those things. So, you know, to end with today, I want to share with you this, that there's some tremendous opportunities. I think some folks who are speaking after me are going to talk about a virtual physical activity challenge, but there's some wonderful virtual physical activity challenges that have created some tremendous opportunities, right? And I think there's this opportunity for many of you that work in faith communities or park and recreation departments to provide some physical activity resources online. I know my mum back in England has been doing a video with Coach Joe every day since the pandemic. So there's a tremendous opportunity to create physical activity resources online for some of the folks that you serve who may not be able to get out and about as much as some others. There's often the opportunity, and the video from Onslow County showed that, to create small social groups, right? As many people are struggling with this lack of human interaction with other people, there's an opportunity to create social groups to be physically active outdoors and maintaining those physical activity distancing or masks when appropriate in there. And then, you know, I think for all of you that work in this sphere, one of the things that I'm working with a number of park and recreation departments, it's important to include the most up-to-date education on how to use these facilities and amenities responsibly. If they're not used responsibly, they're going to shut down, and that is critically important to impress upon people how to use these outdoor spaces responsibly. I have this little quote in here. This was a letter that a mother wrote to Lynchburg Parks and Recreation in Virginia, just talking about the importance of some of these parks and amenities for her. And for those of you that have small children or children that you had to homeschool or deal with, you know, kids not being at home, many of us really went through some painful online or educational experiences. So this was a cool letter that a mother wrote to a park and recreation department, but there's thousands of these letters that came in. So the importance of these outdoor spaces were more than just, you know, from individual. They really, you know, helped many of these families in there. So just a quote to end here. You know, I think this is a nice quote. The upcoming year might be one of the toughest ever to be a health professional, but it might be the most exciting and revolutionary year ever. Mindset will be critical. So that's all I've got. Any questions, you know, at the end, I'm happy to answer them. And sorry I went over time, Breyana.
It's okay. Thank you for such a great presentation, very informative and sharing your expertise. And I think it lends well into our next presentation as we share resources from the state level as well. So I have the pleasure of co-presenting today with Lauren Morris, who is our Steps to Health nutrition educator in Halifax and Northampton counties. She's been with Extension for about 3 years and previously served on the Health Matters grant. So brings a lot of experience as it relates to facilitating and implementing policy systems and environmental change in the field. So I'm excited to hear what she has to say later on in our presentation. So I'm going to start by giving you a little bit of background on who we are as far as Steps to Health and what resources we can offer you. So Steps to Health is North Carolina State University's SNAP Ed grant, where we aim to inspire and educate limited resource populations in eating smart and moving more. So we're able to accomplish this by collaborating with our county extension offices throughout North Carolina. We work closely with our family and consumer science agents, our nutrition educators in the field, and even some of our regional nutrition extension associates to provide direct education targeted towards our limited resource areas. Our education, all of our curriculum is series-based, and we target youth and adult programming. So as you can imagine, our programming can be found in schools and community sites, and of course, our faith-based organizations. And so when we complement our direct education programs with what we call policy systems and environmental change initiatives, also known as PSE, we see that there is such value in improving the systems, the structures within our organizations to foster and promote positive behavior change. And so we do this by training our agents, training anyone that utilizes our resources, and implementing this at the county level. So coming from our state office, we have comprehensive toolkits that really guide our agents and our partners to identify barriers in the community that are preventing people from accessing the resources that they need. On our next webinar, I'll be going through our toolkits in particular, but for now, our toolkits, they are site specific. So any built environment that serves food, we have a toolkit for that will walk you through the resources, the action planning, the trainings, and even some of the promotional materials that will be successful in increasing access, dismantling some of those barriers, and creating a bigger impact as it relates to the health outcomes. Again, we work closely with our partners in the field, and we've seen value in having diverse partnerships to make sure that we can have a community impact, a sustainable change, and in the end that we are helping to make the healthier choice, the easier choice for all of the clients that we serve throughout North Carolina. So as you can imagine, I was talking about our direct education and even some of our PSE toolkits. In light of COVID, everything has shifted. So we have gone to a virtual platform for all of our direct education programming to include pre-K, kindergarten, second grade, third grade, fourth grade, and then our after-school programming. And so we are constantly in the mode of developing resources to make sure that we meet the needs of our community. And that includes our resources for facilitating PSE initiatives at the county level. And so one resource that has been developed recently is our Walking Audit Toolkit, and it's entitled Communities Moving Together. And this resource is definitely relevant in light of COVID, in light of social distancing, and encouraging our communities to not only understand the value of physical activity as it relates to health, but then increasing access to physical activity and the opportunities in their communities. So this is a collaboration between Steps to Health and Faithful Families Thriving Communities that is designed to train community members. So it has a similar structure and or model as a Train the Trainer toolkit. And it's used to really get feedback in how we can improve or how community members can improve the safety, the accessibility, and even the equity opportunities as it relates to where people can access physical activity in where they live, in their neighborhoods, where they work, where they learn, where they play, and where they pray. And we've seen success in these toolkits as we partner with our health departments, our police and fire departments, with our county, local, and state government officials. Dr. Bocarro talked about the social ecological model, and the last bigger circle touches on public policy and how we want to have these small nuggets along the way that influence our public policy so that we can be in a community where it's safe to be physically active, where it's accessible and equitable for all of our participants, particularly our limited resource populations that may not have the resources that they need. So the next couple of slides, Lauren is going to walk through that experience. She's been able to utilize this toolkit in the field, and she's going to talk with us about what it looks like to facilitate and implement this toolkit with different partners, especially in light of COVID and what that means for physical activity now.
Thank you. So I have implemented a couple of walk audits in some rural areas. And I just want to reiterate that when the street environment provides safe and easy connections to everyday destinations, it significantly increases the number of people who can safely walk or bike and just be active. So in addition to improving people's quality of life, active, friendly communities can also encourage more social interaction. And this can still be done, of course, while practicing social distancing guidelines. And it can even help with economic development. And these walk audits can easily be implemented while practicing social distancing. If you were on Monday's webinar, that Dr. Haynes Maslow did last week, she discussed that participants in the survey were asked what can policymakers do to make it easier for people to be physically and mentally healthy during COVID-19. And some responses included the desire for sidewalks and transportation services. So people are thinking about walking to different destinations. And this leads me to believe that this walk audit guide can be an essential tool for communities during this time. However, a walk audit is usually just one part of a bigger picture and a bigger plan to improve the quality of life for people in that community. From my experience, a walk audit that was facilitated last year has been used several times to support grant applications that were related to transportation, including like transportation planning and sidewalk infrastructure, even economic development, and to improve physical activity and parks in that area. So as you can see in some of these pictures, this is from, 3 of the pictures are from one walk audit, and there's one that's from another, but both of these walk audits were conducted in very rural areas. And in one in particular, that community that came together, it encouraged them to start a beautification committee. So when people are walking or biking, you know, it's pleasant to look at and be around. And when you have that kind of environment, it encourages to be more active. So a walk audit toolkit can help guide the walk audit and help enhance and motivate the community to make their environment more accessible for all and encourage that physical activity. So some of you may be on here thinking, well, where would I even start with trying to facilitate a walk audit? But in my experience, I have taken the idea to a town administrator and a mayor, as well as I served on a local coalition that had an initiative to encourage active lifestyles. And in both of these cases, I just discussed the opportunity and the benefits of a walk audit, and it led to notifying and gathering the community to implement it. In the walk audit toolkit, We provide information and ideas to get you started while walking you through each step needed to implement a successful walk audit. And if you have any questions or you want additional information, feel free to use the chat box or contact Steps to Health or Faithful Families directly, and we'll be glad to get you started and to talk more about how to facilitate a walk audit to get more of that, the opportunity for physical activity in any community.
Thank you, Lauren. Thank you so much for assisting me with this presentation. And so lastly, we will hear from our Faithful Families team. We'll hear from Dr. Annie Hardison-Moody, an associate professor and extension specialist in the Department of Agricultural and Human Sciences. She serves as the lead for the Faithful Families program, and her expertise includes health promotion, religion, and health. And also joining her today is the Special Projects Manager for Faithful Families, Kim Eshleman, who is also a part of the Department of Agricultural and Human Sciences. Kim works closely with coordinating programs and events for the Faithful Families team.
Thanks, Breyana, and thanks, Lauren. We're really excited for these walking audit materials to come out, and I know that a lot of you had questions in the chat box about that. And so maybe we can follow up in the Q&A and tell you a little bit more about how you can access those materials, because I think there's going to be a ton of interest in that, the work that you all are doing and the work that we can all do to promote walking and accessibility and equity in the communities where we work. So Kim and I are going to be brief, but we just kind of wanted to share with you all, since a lot of the folks on this call either participated in or promoted the Faithful Families Virtual Walking Challenge that we recently held. And then we want to let you know about the resources for the Walking Challenge that you can continue to use for your communities. So for those of you who are not aware, or for those of you who participated, we did have a virtual walking challenge June 8th through July 5th. And we decided to do this after talking with our national and North Carolina partners about what you all would like to do and how we could support your work and the faith communities that you work with during COVID-19. And so we had the walking challenge materials available already. And so we made a pivot and updated these materials to be a virtual challenge and to be something that people could participate in across the country. It was really exciting. We had over 500 people sign up for the challenge. And we had, the challenge ran for 4 weeks, and we had an evaluation at the end. And of those 500 people, 322 of them filled out the survey at the end, which is awesome. And 22 teams participated in that survey as well. So we know that more people were walking and using the materials, but these are the results from our survey. And from that survey, we saw that teams and individuals walked a total of 491,220 minutes, which is amazing when you think about, as Jason was saying earlier, about all of the hardships that people have been under and how we have all been dealing with the emotional stress, the physical stress, and everything that has come with this pandemic. People coming together and walking across the country is just amazing. We had 9 counties in North Carolina that had teams and 12 counties that had individuals participate. And then we also had teams from Indiana, Louisiana, Nebraska, and Tennessee. Like I said, I'm sure that we had others as well who just might not have filled out the survey. So these are just some kind of very basic preliminary results from the program. We had most of the people who participated seemed to participate as part of a team. And when I tell you a little bit later about that, it makes sense. As Jason was saying earlier, a lot of the best physical activity, or the physical activity research, shows that social support is really crucial in helping people to make and maintain physical activity behaviors. And I know that seemed to be the case as well with the walking challenge. Like, this was an opportunity for people to come together, to work together, to do something with their faith community or with their broader community. We also asked, would you like to participate in similar challenges in the future? The answer was overwhelmingly yes. And the reason I put this slide on here is not to say like, hurrah, faithful families, but is to say for you all who are doing work out in the field, doing these kinds of virtual challenges or virtual experiences, right now, as Jason mentioned earlier, are ways to engage people and keep people connected and to help people to make or maintain habits that can really help not only with their physical health, as we've been talking about, but also with mental health. And so again, there are opportunities here, and there are people who need support and people who want to be a part of something. And so we're going to share with you, or Kim will share with you a little bit later, about how you can replicate this challenge in your community or replicate other kinds of challenges to kind of bolster that social support. Most people also said that they increased their physical activity through walking. We have seen, and we've been posting these success stories on our blog, some incredible success stories that people have had about the number of miles and minutes that they've walked. People have reached out to me to say that they have dropped their medication amounts or have stopped taking medication altogether because they have started walking so much. So there are real powerful, positive health benefits to be had through walking. And some of those, as Jason was pointing out earlier, have been people saying about the benefits of just being out in nature. And I loved some of the conversation that was happening in the chat box about that, with people talking about how important that has been. And also people were saying after the challenge that they, almost 92% of people are saying that they will continue with that walking after the challenge ends. So we really hope that that's the case. And maybe we should follow up with them in 6 months, and reach back out and see how people are doing or what they're doing. So I wanted to share a few of these ideas that people shared, because there were some fantastic ideas that we're looking through as we look at the challenge evaluation. But I'm sharing these so that you all can see, in addition to the data that Lindsay shared and that Jason has shared, these are some things that people are talking about and things that they're passionate about. As I mentioned earlier, the thing that seemed to draw so many people in and keep them connected was the ways that they were able to connect with their team, or ways that they were able to connect with others through this challenge. So I love that quote of all of us during the social distancing, but still being involved together. The newsletters, I think, were helpful to people, but from the comments, it seems like the most successful piece of the challenge was the things that we didn't do, is the ways that team leaders and challenge participants and people kind of got together and supported one another. So I love these. We built a way of encouraging each other to do our best. Follow the fellowship with my friends. We've grown closer. Like, these are the things that, as we think about everything that we're all going through right now, like, these are the things that matter. And then some comments about the beautiful walking trails that people have seen and used now. Some ideas that people had for improvement were one of the reasons why I put this particular group of comments up here was adding the brief nature observation component. I don't know who put this one in, but this was such a neat suggestion of, if you're doing a sort of challenge like this, asking people to reflect on what they're doing and why they're doing it. And I think that points to some of what Jason was saying about mental health, and also some of the comments that Joy and I saw others were saying about, if we can help people to make those connections even stronger between their physical and mental health, there's more real power in that, and helping people to, because we all know that there is an impending mental health crisis. I mean, it's not impending, it's on us right now with this pandemic. And so ways to help people build those positive mental health coping strategies and mechanisms would be really helpful. And if you would like some additional thinking about that, or to learn a little bit more about that, I definitely encourage you to check out the the webinar that Dr. Janae Avent-Harris did for the Faithful Families Virtual Summit. And that is on our website. So if you go to our website, and Kim can maybe show you where that is on our website, but that webinar is there. It's about mental health and faith, but she talks a lot, because we did the virtual summit right at the beginning of the pandemic. She talks a lot about the importance of addressing mental health and thinking about mental health. And then some other comments that people had were ways to engage kids and families. And I think, given the work that so many of us do about families, I think that was a really important thing to point out as well, and something that we want to keep thinking about. Things that people would like to see in future challenges. Some people wanted to see this one repeated. Gardening challenges, like how interesting would that be? We do have the fruits and vegetable challenge on our website. Kim can show you that one. Virtual races, things like that. So similar to what Jason was pointing out earlier, people are interested and want to connect in different ways. And if you can find ways to help them do that and to support each other, it could be really great. And so I want to turn it over to Kim, who's going to share with you, that ended the virtual challenge that we did together across the Faithful Families program, but all of those materials are on our website. So if you want to do your own virtual challenge, I'm going to hand it over to Kim, and she can show you how to use those resources that are on our website. I'm going to stop my screen share.
Thank you, Annie. We really were excited to see all of the outcomes and the experiences from this walking challenge. So I'm going to share my screen and just walk you through really quickly, it won't take long, the resources that we have on our website so that you can use them as well. So even though the All Faithful Families challenges ended, these materials are still available to you, and we hope that you'll be able to utilize them to create your own challenges in the communities you work in. So on our homepage, you'll see a banner at the top, the Virtual Walking Challenge 2020, and you can click on the banner. It will take you to a page where all of these resources are housed. So under the Materials tab, you'll find everything you need to put together a walking challenge in your own community. A good place to start would be the Organizing the Virtual Walking Challenge guide. And so this will really give you an overview and also give you a step-by-step guide to putting together your own challenge. Also on this materials page, you can find everything you need for promoting the challenge, celebrating your participants, staying organized. So you'll find a promotional poster here that you can use to advertise the challenge. And all of these files are writable. So you can edit them on your computer and print them out, or if you wish, you can print them and then write on them and post them in paper. We also have a sign-up sheet that you and or your team leaders can use to keep track of your participants with their contact information. That file is also writable. And you can also find a walking challenge log that you can distribute to your teams and participants that will really make it easy for them to keep up with their minutes and their challenge points and to get those back to their team leaders and to you at the end. Additionally, at the end, we found it was really exciting to be able to recognize participants and their hard work and their participation. So there's a certificate of participation here that's also editable and that you can use to do that. Finally, on this materials page, you can find some sample social media posts that we have that we used during the 4-week challenge, but you can also use and adapt as you see fit. There are, I believe, 5 posts per week for 4 weeks. And so feel free to use those for ideas to keep your teams and participants motivated and quick tips for staying physically active. We found that was another really great way to connect as a team. Also here on the newsletters tab, you can find weekly newsletters for 4 weeks that you can download and send to your teams or your team leaders or your participants. And these are just a really great way to start off a week with ideas for keeping people physically active, keeping them connected, which we found was a really important piece of this, just the idea of social support and staying connected with one another. And so those are the resources for the walking challenge. And we hope that you're able to use them and create your own challenges with the faith communities and other communities that you work with. We would love to hear about your experiences and hear how it goes. So always feel free to tag us on social media. We're on Facebook at Faithful Families Thriving Communities and at FF Thriving on Twitter. And while you're there, you can also check out some of our posts from the 4-week challenge that just wrapped up on the 5th of July. You can also read more. Annie was talking about some of our success stories and more about the outcomes that we had from that on our blog. And you can find that here at the top toolbar on our webpage. So there are success stories here for individual churches. And then this post here will kind of give you a summary of all of our prize winners and some success stories from individuals and teams. And we would also love to hear your stories. So feel free to reach out to us and let us know how it goes. I believe there was, the webinar that Annie mentioned from our summit on mental health. So if you also on our homepage, you can access this with from the banner under the virtual summit. And you can find links to those webinars in particular. I'm not remembering off the top of my bat.
It was day 3. It was
day
mental
3.
Health.
Okay, thank you. So on day 3, our focus was faith and mental health, and you can find all the resources here, but in particular, the conversation with Dr. Janae Avent-Harris, which was fantastic. You can watch the recording of the webinar here on that page. I believe there was one other thing. So I believe Annie mentioned the fruits and veggies challenge. So you can also find that challenge and those materials under our tools and the healthy eating tab. If you scroll down, you will see that. I just went past it. The fruits and veggies challenge. So that's just another challenge you can use. And during this time, it could be a great way to stay connected with your communities and to keep them engaged with you and with one another. As always, if you have any questions, please feel free to reach out to Annie or I. Our contact information is on our webpage. I know many of you already know our contact information, but if you need us, we're here, and you can find that under our Meet the Team webpage. And did I miss anything, Annie?
Nope, that was great.
Yep. Thank you all.
Thank you, Annie and Kim. And for those that are interested in connecting with your family and consumer science agent in the field, they can also help you to be connected to these resources. So whether it's through the agent or the Faithful Families facilitator, each county is going to be different in some of the resources that they offer. I know that some counties are offering physical activity challenges that you can do at home, like a physical activity bingo, or physical activity challenges that you do during commercial breaks. So there are lots of resources available. I encourage you to connect with our Faithful Families team, with the Steps to Health team, and then with your local extension office. So we have a few minutes left for questions. I think I saw one about accessing the toolkit. So again, you're going to want to connect with your family consumer science agent in your county, and they can help to assist in providing these resources that are provided or developed at the state level. And then you can also connect with your Faithful Families facilitator as well to access these resources. I think there was another question on grants. And Dr. Bocarro, let me see if I can find it. The question is, are there grants available to help structure physical activity within communities, even perhaps using this toolkit?
Yeah, I shared with Annie a couple of potential resources for grants. The other thing is I know Aetna, I don't know about Blue Cross Blue Shield right now, but some of the health insurance companies, if it's positioned right, may be willing to fund a post-COVID opportunity for the right community or the right organization. And then in the past, the Robert Wood Johnson Foundation has provided opportunities, and I know they're very, very interested right now in this issue of health equity, particularly if you work in a community that is under-resourced. They're always interested in providing some resources in there. So those are some organizations, but this is a weird time right now. So financially, for a lot of nonprofit organizations, health insurance companies right now. So things are changing daily. But again, I provided Annie with a few resources out there.
And I put those in the chat box.
Perfect. I know when I was in the field, we applied for grants through Safe Routes to School. So that might be another avenue to research. And then one of the counties I served applied for a Kaboom grant to get new physical activity equipment and structures for a local park. So I would definitely recommend checking out those resources as well. Do we have any other questions or any comments about what we what we've discussed so far? All right, it looks like hopefully we've answered all of your questions. Well, thank you all for joining us. Again, our last webinar is next Monday at 1 p.m. And we will talk about some of the projects and resources around addressing food insecurity in your community. So I hope you will join us. Thank you again, Dr. Bocarro, Lauren, Annie, and Kim for presenting today and sharing resources with our audience. I hope you all have a great rest of your day and enjoy the rest of your week. Please stay safe.